Good afternoon, everyone. My name is Odessa Camello from the big city, currently taking a Master of Education, major in Special Education, under Dr. Ada Damian, with the subject of Teaching Strategies for Children with Special Needs. This film is being prepared to discuss teaching ideas for children with exceptional needs. Since the majority of my classmates have completed all of the teaching strategy topics and are fully capable of sharing their knowledge with you, I have created another topic that is prerequisite to teaching the tactics that my lovely classmate will share with all of you. For today, I'm going to teach all the basic information about children with special needs. Contrary to the myths and Asian beliefs, special needs children can be integrated into the classroom with proper knowledge, supervision, and aid. Remember that various laws in the Philippines govern special education and inclusive education. These laws were enacted to protect the rights of all children in the Philippines regardless of their learning abilities. Now, let us dive into the heart of this video. What are special needs? Special needs is an umbrella term. There can be serious or mild mental disabilities, allergies, psychiatric problems, or developmental delays. We will cover mental or cognitive, health, or physical and behavioral needs. As a special needs educator, this should be the basic knowledge that we need to specialize in, so that we can not only understand our beloved students, but also share this information with the public and parents and ensure that our mainstream students understand the needs of their neurodivergent classmates better. Cognitive, mental, or special needs. Cognitive special needs refer to challenges or differences in cognitive functioning that impact an individual's ability to learn, process information, solve problems, and interact with their environment. These needs are often related to how the brain processes and understands information. Cognitive special needs can manifest in various ways and can be caused by different factors, including genetic conditions, brain injuries, developmental disorders, or environmental factors. One of the examples of that is Asperger's syndrome, pervasive development disorder or delay in basic skills. This is similar to autism, but it is more common. The cause is unknown, but may be hereditary. Usually diagnosed between the years of 2 to 6 years old, this cannot be prevented or cured. The symptoms of Asperger's syndrome are now included in a condition called autism spectrum disorder, or what we call ASD. ASD is now the name used for a wide range of autism-like disorders. Some providers may use the term Asperger's syndrome, but others will say ASD. This is without intellectual or language impairment. What are the symptoms to watch for Asperger's syndrome? Bad social skills, difficulty interacting with peers, cannot carry a conversation, eccentric or having repetitive behaviors, such as rigging of his or her arms or hands, unusual preoccupations, may develop strict rituals. They cannot communicate. They have little eye contact and they misuse gestures. They also have limited interest and they may obsess over one that is of interest. They have bad coordination. They seem like clumsy at times, but they are highly skilled in one area or they have an exceptional talent. While there is no cure for ASD, including Asperger's syndrome, various interventions and therapies can help individuals manage their symptoms and improve their quality of life, like taking medication for symptoms for anxiety disorder, depression, and OCD, undergo behavior modification. Strategies can be implemented to support medication to support positive behavior, and of course, enrolling them to special education. Attention deficit hyperactivity disorder. It's important to note that ADHD is a complex neurodevelopmental disorder, and individuals may present with symptoms that vary in severity and combination. Additionally, ADHD symptoms can change over time, and some individuals may experience fluctuations in symptom severity or may predominantly display one set of symptoms over another at different points in their lives. ADHD, or what we call attention deficit hyperactivity disorder, is typically classified into three main types based on the predominant symptoms. Number one, predominantly inattentive presentation, or what we call ADHD-PI, formerly known as ADD, or the attention deficit disorder, or simply ADHD, but without the hyperactivity component. The second one is predominantly hyperactive impulsive presentation, or what we call ADHD-PH. This type is characterized primarily by hyperactivity and impulsive behaviors. And the last is the combined presentation, or ADHD-C. This is the most common type of ADHD and involves a combination of both inattentive and hyperactive impulsive symptoms. Individuals with ADHD-C exhibit symptoms of both inattention and hyperactivity, impulsivity across various settings and situations.
Don't count or estimate. How many? It's less than 20, but it's probably more than one. 20, okay? What do you think? 12. What do you think, Andy? Oh, that's 4. What do you think, Dylan?
What are the symptoms to watch for? These are the most visible indicators that we need to be looking out for if we suspect a child has ADHD. Number 1, inattention. Little attention to details. They are easily distracted. It appears that they're not listening when they are spoken to. They have difficulty remembering things and following instructions. They are also disorganized and loses work and gets bored with a task before it's completed. Hyperactivity, constantly screaming, leaves his or her seat, always going against the rules. They talk excessively. They are always on the go. They have difficulty playing. They are quietly staying still and very quick-tempered. Impulsivity, acts without thinking. They blurt out their answers and they cannot wait in line. They often interrupt others. They guess rather than solve problems. They have inability to keep emotions in check, and most of the time they give temper tantrums. The diagnosis and treatment of ADHD typically involve a comprehensive evaluation by a qualified healthcare professional, such as psychiatrists, psychologists, or pediatricians, who considers the individual's symptoms, medical history, and functional impairments. Treatment may include a combination of behavioral interventions, medication, education, support, and accommodations to help individuals manage symptoms and improve their quality of life. In this slide, I will show you a typical intervention center. It's set up and highlight the crucial equipment you can see inside. The equipment inside an intervention center for autism spectrum disorders plays a crucial role in providing effective therapy and support for individuals with autism. Intervention centers often include specialized therapeutic tools and equipment designed to address the unique sensory communication and behavioral needs of individuals with autism. These tools may include sensory integration equipment, example swings, trampolines, and sensory mats. Equipment such as sensory rooms, sensory toys, weighted blankets, and tactile materials can help individuals regulate their sensory experiences, reduce anxiety, and improve focus and attention. Intervention centers may utilize equipment and tools to implement behavioral interventions and support positive behavior management strategies. This could include token boards, visual timers, behavior charts, and calming sensory items to help individuals regulate their emotions, and engage in appropriate behaviors. The equipment intervention centers is often tailored to meet the specific needs of each individual with autism. Therapists and educators use assessments and observations to determine which tools and equipment will be most beneficial for each person, ensuring that interventions are specialized and effective. So while the equipment, toys, and other items in the intervention center may not make much sense to us, they have a significant impact on each child's therapy session. Sensory integrative dysfunction. Sensory integration dysfunction, or what we call SID, also known as sensory processing disorder or SPD, is a condition where the brain has difficulty organizing and making sense of information that they receive through the senses. This can lead to challenges in regulating responses to sensory input such as touch, sound, taste, smell, sight, and movement. Individuals with SID may experience hypersensitivity or over-responsiveness, or hyposensitivity or under-responsiveness to sensory stimuli, leading to difficulties in daily functioning, such interactions and learning. What are the symptoms to watch for? It's important to note that not all individuals with sensory sensitivities will exhibit all of these symptoms, and some may display a combination of sensory seeking and sensory avoidant behaviors. Attention and regulatory problems. The child can inhibit non-essential sensory information and is considered distractible. They are always on alert. He or she notices sound like a fan or fridge that other people tune out, or is unresponsive to stimuli. They seek out intense sensory experiences or exhibit a high tolerance for pain, temperature, or physical sensations, often engaging in rough play or seeking out deep pressure. These children have a high pain tolerance. They don't feel any pain and don't even aware that they're bleeding from wound. They have the sensory defensiveness, which is fight, flight, or fright. Symptoms to watch out for. These symptoms can vary in severity and may present differently depending on the individual and their specific sensory preferences and sensitivities. Overreactivity or hypersensitivity. They have strong negative reactions to sensory stimuli like loud noises, bright lights, or certain textures. Treatment. Treatment for sensory integration dysfunction is individualized and may involve a combination of therapeutic approaches that is tailored to the specific needs and goals of each individual. Here are some of the treatment that can help them. Sensory integration therapy, environmental modifications, individualized sensory diet, occupational therapy, parent and caregiver education, collaboration with multidisciplinary team, behavioral interventions, and medication. Tourette's syndrome. Tourette's syndrome is a neurodevelopmental disorder characterized by repetitive, involuntary movements and vocalizations known as tics. These tics can range from mild to severe and can be motor. This involves movement and vocals involving sounds or words. Tourette's syndrome can emerge in childhood or adolescence and can vary in frequency, intensity, and type of tics over time. What are the symptoms to watch out for? Eye blinking, repetitive throat clearing, kicking movements, arm thrusting, jumping, and shoulder shrugging. Treatment. So what is the treatment for Tourette's? Management of Tourette's syndrome may involve various interventions, including behavioral therapies, medication, and support services to help individuals manage their symptoms and improve their quality of life. The triggers and cues are important concepts in understanding and supporting individuals with autism spectrum disorder or ASD. Triggers are events or situations or sensory input that can cause emotional or behavioral reaction in individuals with autism. Cues, on the other hand, are indication or used to convey information. Expectations or transitions to people with autism. Visual cues such as pictures, symbols, Schedules or visual clocks are very useful for people with autism because they can provide solid and reliable information. These cues can help people comprehend what is going on, what is expected of them, and what will happen next, lowering their fear and encouraging independence and involvement. Any words, sounds, or gesture that signal distress should be picked up immediately. Each is specific to the child and develop its own cues. To trigger events, letting adults who spend time with them consistently become aware that there is a problem. Such cues can be becoming ill, sweating, gesture expressions, becoming withdrawn, or irritable, or having tantrum. Providing support and attention to these triggers is the key to keeping the child in control and safe at all times. Parents, teachers, and doctors need to communicate and share information about triggers regularly because each sees the child in different situations. Some children will need special training to develop control they learned from IEP, so the child can respond appropriately in times of stressful conditions. Now that we already have discussed cognitive or mental special needs, let's now talk about children with emotional or behavioral special needs. Children with emotional and behavioral special needs require support and understanding to address challenges related to their mental and behavioral needs. Display behavior that is not typical for children their age. 1 in 5 children suffer from emotional or behavioral disorder, or disorders can be external or internal. External disorder. Externalizing behavior in emotional disorders in children with autism spectrum disorder, or ASD, refer to condition where individuals with ASD exhibit behaviors that are outwardly directed, disruptive to others, and may involve aggression, defiance, or impulsivity. Internal disorder. Internalizing behavior and emotional disorders in children with autism spectrum disorder, or ASD, refer to condition where individuals with ASD experience emotional difficulties that are primarily internalized and not outwardly expressed through observable behaviors. Addressing internalizing behavior and emotional disorders in children with ASD requires a tailored approach that considers their unique needs and characteristics. Causes. The causes for internalizing behavioral and emotional disorders in children with autism spectrum disorder can be multifactorial and complex. The relationship between neurotypical or normal children and children with autism spectrum disorder can vary depending on various factors such as the age of the children, their personalities, their understanding of ASD, and the support they receive from adults. Physical disabilities. Physical disabilities in children refer to conditions that affect a child's physical functioning, mobility, or ability to perform everyday tasks independently. Types of physical disabilities. Overall understanding and addressing the challenges associated with physical disabilities in children is essential for promoting their full participation, inclusion, and well-being in society. What are the causes of physical disabilities in children? They can have various causes, ranging from congenital conditions to acquired injuries or illnesses. Acquired injuries or illnesses. Physical disabilities acquired after birth due to injuries, illness, or medical condition. Down syndrome, a genetic disorder caused by the presence of an extra chromosome 21, leading to developmental delays, intellectual disability, and characteristic physical features. The treatment in classroom. The slides shown are basic examples of the need that neurodiverse children face in their daily lives. It is up to us to assist them to reach their full potential and thrive in their academic and everyday life. As we end our discussion regarding children with special needs, I want to take a moment to celebrate each of you. I want to celebrate your hard work, determination, and unique talents that made us all instrument in helping children with special needs. Remember, you can achieve great things, and it's crucial to always believe in yourself. I am proud of each and every one of you and excited to see all the beautiful things we can accomplish to make a better world for these gifted children. Again, my name is Odessa Camello, a student of MAED SPED 3318. Thank you.